Lerch, you're excited. We've got a new building and a whole lot of extra staff.
We're extremely excited. This is really a celebration for the community and for MCMC as we grow with the communities we serve.
Tell us a little bit about the new addition to the hospital and what it's going to entail.
Really, it's an addition of primary care clinic here and really to serve a really critical role in access to care. I identified when I came here, back in 2012, we only had 6 providers serving this region. So part of our recruitment and retention and opening that access to care, we said we're going to have a new place designed around our customers and for our providers. So we began that design back 18 months ago. So we worked with the state government to get new bonding through the Finance Authority, and Governor Martinez and Lieutenant Governor Sanchez really helped with that process. We were able to allocate $3.2 million in new bond funds for this clinic. So we began the construction last October, and we completed ahead of schedule and under budget, which is phenomenal in today's world.
It is, and doctors, you've got new doctors coming in, and the whole thing, part of the conversation has always been, how do you get doctors from the big city with all the glitz and glamour and everything to do there to come to a small community like Raton? Explain how you've worked that out.
Yes, and we've really been focused, number one, demonstrating our commitment to that primary care, and this clinic was that first step. But then really as we recruited new practitioners, we stressed how we are rural health, but how critical the access need is here, and our philosophy on how we treat our customers, how we partner with our practitioners. They're just not a number, because in many urban areas, they are just an employee. Here, they truly are a partner in that care setting, and they have a focus on quality and personalized care that they don't experience at larger institutions.
And there are different sections of the new clinic. Can you explain some of that?
Absolutely, and we're really excited as we strengthen our overall care for women's health. So we have 2 tremendous OBGYN physicians, Dr. Jessica Roberts and Dr. Luisa Chavez, who provide OBGYN women's health services along the entire spectrum. Then we also have primary care. And Kirsten Adams is a certified nurse practitioner who joined us about a year ago for family medicine. And we also have Dr. Christine Lopez, who's internal medicine and gerontology. Her husband's been with us for about 2 years now. He is internal medicine and pediatrics. And we just partnered with Dr. Cosme, who is also a pediatrician and certified. So, adding those critical services was a big part of this growth.
And everything has come together. Today's the opening ceremonies for the new facility, and people can have tour and everything else today.
Yes, we're excited. Again, this is a community celebration, inviting everyone to come out, really experience what the new era of healthcare is coming to be. This facility was designed around our customers and the patients and improve their access. So we really want it to make sure people understand it's for them and how we can access. And I will stress, many people overutilize, this is nationwide, the emergency department for their primary care, which is not the appropriate setting. And this allows them to come in, and we can help them with different insurances, from Medicaid to the new expanded exchange to other plans available to them.
MCMC has also gotten the accreditation of a trauma unit. Explain that to us.
Yeah, that was very exciting. About a year and a half ago, we brought in some great team members who focused on bringing our emergency services up to a trauma level 4 designation. And we became the 4th trauma level 4 in the state of New Mexico. So it was very hard, and they looked at quality and how we had our coverage for surgery, for how we had our team prepared for different levels of trauma coming here. And we will be going on to a trauma level 3 designation, and there are only also 3 of those in the state. So this just demonstrates how prepared we are for the different traumas that, as you know, can occur in this region.
Yeah, and all hours of the night. So you said there will be a helicopter stationed here, and it will be 24/7.
Yes, we're also very, very excited about that. Our primary partner is Tri-State Care Flight, and they have currently 12 different helicopter stations throughout the state, but they recognize there's really a gap up here in northeastern New Mexico. So we've been working closely with them, and they will have a helicopter here on our pad 24/7 and available to go out in the field and pick up people very quickly and take them to the appropriate setting. And that includes MCMC because, as you said, we are a trauma level center.
Okay, thank you very much, Shawn.
Appreciate it.